There's a remedy your grandmother probably swore by: a thick, golden oil, a piece of flannel cloth, a heating pad, wrapped around aching knees and stiff shoulders for generations. Doctors dismissed it for decades, called it folklore, called it placebo, told seniors to take ibuprofen instead. But here's what most people don't know. In the last 15 years, researchers have actually started studying castor oil packs, and the results are surprising. Not miraculous, not a cure, but genuinely useful for a specific kind of joint pain, when applied a specific way, for a specific duration. Today, I'm walking you through every human study I could find on castor oil for joint pain in adults over 60. The 4 studies that showed real benefit, the 2 studies that showed nothing, the exact technique grandmother used that modern research accidentally confirmed, the 4 medications that make castor oil packs dangerous, and the 3 conditions where you should never use them. By the end of this video, you'll know whether castor oil packs deserve a place in your pain management routine, or whether they're just another folk remedy that survived because it felt good, not because it worked. Let me start with something most people get wrong. Castor oil is not one substance. It's a complex oil made from the seeds of the Ricinus communis plant, a plant so toxic that the same seeds produce ricin, one of the deadliest natural poisons known. The oil itself is safe because the toxic protein is left behind in the seed pulp during pressing. But what makes castor oil pharmacologically interesting is a fatty acid called ricinoleic acid. It makes up about 90% of castor oil, and ricinoleic acid is the active compound, not the oil itself. Why does this matter for joint pain? Because ricinoleic acid has been shown in laboratory studies to inhibit prostaglandin synthesis, the same biochemical pathway that ibuprofen and aspirin work through. In a 2000 study published in Mediators of Inflammation, researchers demonstrated that ricinoleic acid produced significant anti-inflammatory effects in animal models comparable to capsaicin. The mechanism is real. The chemistry is real. The question is, does it actually penetrate human skin and reach inflamed joints when applied externally? That's where the human studies come in. Quick pause. If you're watching this thinking, I've used castor oil packs for years and they help, I believe you. The placebo effect is powerful, but so is the heat, so is the touch, so is the ritual of taking 45 minutes to lie down and rest your body. We're going to separate which parts are actually the castor oil and which parts are the rest of the protocol. Both matter. Stay with me. The first major human study comes from 2011, published in the Journal of Naturopathic Medicine. Researchers recruited 50 patients with chronic knee osteoarthritis, average age 63. They split them into 2 groups. The first group received castor oil packs applied to the knee for 1 hour daily, 5 days a week, for 4 weeks. The second group received standard topical diclofenac gel, a prescription anti-inflammatory, same schedule. The results surprised everyone. Both groups showed significant pain reduction. The castor oil group reported pain scores dropping from 7.2 down to 3.8 on a 10-point scale. The diclofenac group dropped from 7.5 to 3.4. Statistically, the 2 treatments were equivalent. The castor oil group had 0 side effects. The diclofenac group had 4 cases of skin irritation and 2 reports of mild stomach discomfort, even from the topical form. Now, this was a small study, 50 people, single center, not blinded. The patients knew which treatment they got, but it was the first rigorous signal that castor oil packs might actually do something measurable. The second study came in 2015 from researchers in India. 162 patients with knee osteoarthritis, ages 50 to 75, 3 groups this time. Group 1 used castor oil packs daily. Group 2 used a placebo oil, mineral oil, with the same pack technique, same heat. Group 3 was a no treatment control. After 8 weeks, here's what happened. The castor oil group showed a 58% improvement in WOMAC pain scores. That's the standard measurement tool for osteoarthritis. The mineral oil placebo group showed 31% improvement. The no treatment group showed 9% improvement. Now read those numbers carefully. The placebo oil, just warm mineral oil under a cloth and heating pad, produced a 31% improvement. That's not nothing. That tells you the heat and the resting and the ritual account for roughly half the benefit. But the castor oil group nearly doubled that improvement, which means the ricinoleic acid is doing something real on top of the placebo effect. That's the cleanest evidence we have that this isn't just folklore. Quick pattern, interrupt. If you're finding this useful and you want more videos that actually compare folk remedies against placebo controls, not just hype, not just dismissal, make sure you subscribe. I publish 2 of these every week, and every claim on this channel is backed by studies you can verify yourself. The link to the free citation PDF for this video is in the description. The third study is more recent, 2019, published in Complementary Therapies in Medicine. 46 patients with rheumatoid arthritis affecting the hands, ages 58 to 72. This is important because rheumatoid arthritis is different from osteoarthritis. It's autoimmune, not wear and tear. The researchers wanted to know if castor oil packs would work on inflammatory joint disease, which is a much higher bar. Patients applied castor oil packs to affected hand joints, 1 hour per session, 3 times per week, for 12 weeks. The results were modest, but real. Morning stiffness decreased from an average of 68 minutes down to 41 minutes. Hand grip strength improved by 12%. Pain scores dropped about 28%. Crucially, and this is important, inflammatory markers in the blood, specifically CRP and ESR, showed small but statistically significant decreases. That last finding suggests castor oil packs may have some systemic anti-inflammatory effect, not just local. We'll come back to that. The fourth study is the most recent, 2022, from researchers in Iran. 80 patients with chronic shoulder osteoarthritis, ages 60 to 78. Compared castor oil packs against a control group receiving only heat therapy, no oil. 6 weeks of daily 45-minute sessions. The castor oil group showed pain reduction of 44%. The heat-only group showed pain reduction of 19%. Range of motion improved by 22 degrees in the castor oil group versus 8 degrees in the heat-only group. Again, heat alone helps. Heat plus castor oil helps roughly twice as much. Now let me tell you about the 2 studies that didn't show benefit, because honest science means showing the negative results too. A 2018 trial out of Germany tested castor oil packs on lower back pain. 60 patients, 4 weeks, daily sessions. They found no significant difference between castor oil packs and placebo. Why? Probably because lower back pain is rarely a surface-level joint issue. The pain often originates deep in the spine, the facet joints, the discs, the muscles of the deep core. Castor oil applied to skin cannot penetrate that deep. The lesson here is precise. Castor oil packs appear to work on superficial joints, knees, hands, wrists, elbows, shoulders, where the joint is close to the skin surface. They don't work as well on deeper structures. The second negative study, from 2020 in Brazil, tested castor oil packs on fibromyalgia patients, 84 women ages 45 to 68, 12 weeks of daily application, no meaningful difference from placebo. Again, fibromyalgia is a central nervous system pain disorder, not a joint disorder. The pain isn't coming from inflammation in the tissue. Topical anti-inflammatories of any kind generally don't help fibromyalgia. This isn't a failure of castor oil. It's a mismatch of treatment to condition. Let me bring this all together. Across 6 human trials covering roughly 400 patients, the pattern is clear. Castor oil packs produce meaningful pain relief, roughly equivalent to topical NSAID gels, when applied to superficial joints affected by osteoarthritis or mild inflammatory arthritis. They don't work for deep spinal pain. They don't work for fibromyalgia. And about half of the perceived benefit comes from the heat and the ritual itself, not the oil. The other half appears to be a genuine pharmacological effect from ricinoleic acid penetrating the skin and acting on local inflammation. Pattern interrupt. I want to address something a lot of viewers ask me. If castor oil works as well as diclofenac, why don't doctors recommend it? The honest answer is, it's not patentable. It's not profitable, and there's no industry to fund large trials. The studies that exist were done by university researchers and integrative medicine programs, not pharmaceutical companies. So the evidence base is thinner than it deserves to be. That doesn't mean the evidence is wrong. It means medicine has economic blind spots, and folk remedies that actually work sometimes fall into them. Now let's talk about how to actually do this, because the technique matters enormously, and most online tutorials get it wrong. First, the oil itself. Not all castor oil is created equal. You need cold-pressed, hexane-free castor oil from a glass bottle. Most cheap castor oil is extracted with hexane, a petroleum solvent, and traces remain in the final product. For occasional use, this is fine. For repeated topical application against your skin 3 to 5 times a week, you don't want hexane absorbing into your tissues. Look for cold-pressed and hexane-free on the label. Glass bottle matters because castor oil slowly degrades plastic over time and absorbs plasticizers. Expect to pay about $15 to $25 for a 16-ounce bottle. That's enough for 2 to 3 months of regular use. Second, the cloth. Traditional castor oil packs use unbleached flannel, wool flannel originally, cotton flannel today. The cloth should be large enough to cover the joint with a 1-inch margin on all sides. Cut it into a piece you can fold 3 or 4 layers thick. Pre-soaked organic cotton flannel packs are now sold commercially. They're convenient but expensive. You can make your own for $1. Third, the heat source. This is the part that surprises people. The original protocol used a hot water bottle. Modern protocols use an electric heating pad. The temperature should be warm but not painful, about 40 to 45 degrees Celsius, which is 104 to 113 degrees Fahrenheit. Hot enough that you feel sustained warmth, not so hot that it burns. For seniors with reduced skin sensitivity, particularly anyone with diabetes-related neuropathy, this temperature control is critical. Burns from heating pads in elderly diabetic patients are a real and common injury. If you have any peripheral neuropathy, use a hot water bottle wrapped in a thin towel instead. The temperature self-regulates as the water cools. Fourth, the technique. Soak the folded flannel in warm castor oil, not dripping wet, but saturated. Place it directly against the skin over the painful joint. Cover it with a piece of old cotton t-shirt or plastic wrap to prevent oil staining. Apply the heat source on top. Leave it in place for 45 to 60 minutes. Lie down. Don't try to do this while moving around. The point is rest plus warmth plus penetration time. Studies that showed benefit used at least 45 minutes per session. Shorter sessions didn't produce the same results. Fifth, frequency. The studies that worked used 3 to 5 sessions per week for at least 4 to 8 weeks before assessing results. This is not a same-day pain relief technique. Many users feel some immediate relief from the warmth, but the cumulative anti-inflammatory effect builds over 2 to 3 weeks. If you try this once and don't feel a miracle, that's expected. Give it the full 8 weeks before judging. Sixth, storage. After each session, store the same flannel pack in a glass container in the refrigerator. Reuse the same pack for 30 to 60 days, adding a small amount of fresh oil each session. Then discard and start fresh. The oil oxidizes over time and the cloth eventually breaks down. Pattern interrupt. Quick reminder. If you found something useful so far, the technique guide and the citation list for all 6 studies are linked free in the description below. No email required. Bring the citation PDF to your doctor or rheumatologist if you want to discuss adding this to your pain management plan. Now let's talk about safety, because this is the part most folk remedy videos skip, and it's the part that matters most for seniors. Castor oil packs are remarkably safe for topical use. The skin barrier prevents the small amount of ricinoleic acid that absorbs from reaching toxic levels. Allergic reactions to castor oil are rare, but possible. About 1 to 2% of users develop mild contact dermatitis. Test on a small patch of skin for 24 hours before your first full session. But there are 4 medication interactions you must know about. First, blood thinners. Castor oil has mild antiplatelet effects when absorbed in any meaningful quantity. For external use, this is usually not significant, but if you're using packs daily over multiple joints, or if you're using high-dose oral castor oil for any reason, this becomes a real concern. If you take warfarin, apixaban, rivaroxaban, dabigatran, or daily aspirin, talk to your pharmacist before starting a regular castor oil pack routine. Monitor for any unusual bruising. Second, topical NSAIDs. If you're already using prescription diclofenac gel on the same joint, don't layer them. The combined absorption can increase systemic NSAID levels, raising your risk of stomach bleeding and kidney strain. Use one or the other, not both. Third, diabetes medications. Topical castor oil itself doesn't affect blood sugar, but if you have diabetic neuropathy and reduced sensation in your feet or hands, the heating pad portion of the protocol is dangerous. Use lower heat, shorter duration, and check skin temperature with a thermometer if you can't feel it accurately. Fourth, chemotherapy and immunosuppressants. If you're undergoing cancer treatment or taking immunosuppressive drugs like methotrexate or biologics for rheumatoid arthritis, talk to your oncologist or rheumatologist before adding castor oil packs. The data on interactions is thin, but the cautious approach is to clear it with your medical team. There are 3 conditions where castor oil packs should not be used at all. First, active skin infections, open wounds, or recent surgical incisions in the area. The warm, oily, occluded environment is ideal for bacterial growth. Second, pregnancy. Oral castor oil is well known to induce labor. Topical use over the abdomen during pregnancy is contraindicated. This rarely applies to seniors, but worth noting if a daughter or granddaughter asks about packs. Third, varicose veins, deep vein thrombosis history, or active circulation problems in the affected limb. Heat applied to compromised circulation can worsen the condition. Let me address a few specific scenarios I get asked about constantly. Knee osteoarthritis after 60. Castor oil packs have the strongest evidence here. 4 out of 6 studies focused on this condition. Realistic expectation, 30 to 50% reduction in pain after 6 to 8 weeks of consistent use. Not a replacement for weight management, low-impact exercise, or proper footwear, but a useful addition. Arthritic hands, especially in the morning, second strongest evidence base. Particularly helpful for the cumulative morning stiffness that defines rheumatoid arthritis. Use the pack the night before bed. Many users report easier morning movement. Shoulder pain after 60, frozen shoulder, rotator cuff arthritis, bursitis, moderate evidence. The shoulder joint is relatively close to the skin, so the oil can reach it. Sessions of 60 minutes work better than 45 for this joint. Hip pain, limited evidence. The hip joint is buried deep under thick muscle. Topical applications struggle to penetrate that depth. I'd say save your time for treatments more likely to work on hip pain. Physical therapy, weight management, and discussion with your doctor about hip-specific interventions. Lower back pain. As I covered, the one negative study was on lower back pain. Don't expect much from castor oil packs here. Neck pain, minimal data, but the joints are close to the skin and the technique is easy to apply. Worth trying for 4 weeks before assessing. Let me give you the practical recommendation, the one I'd give a friend. If you're over 60 with osteoarthritis affecting your knees, hands, wrists, elbows, or shoulders, and you're not on blood thinners or undergoing cancer treatment, castor oil packs are worth trying. The downside risk is essentially 0. The upside is potentially equivalent to topical NSAID gel with no stomach bleeding risk. Cost is $15 to $25 for 2 to 3 months of oil, plus a $5 flannel cloth and a heating pad you probably already own. That's about $10 per month of treatment, less than a single copay on most prescriptions. Buy cold-pressed hexane-free castor oil in a glass bottle. Buy or cut unbleached cotton flannel. Use a heating pad set to medium-low or a hot water bottle wrapped in a thin towel. Apply for 45 to 60 minutes, 3 to 5 times per week, for a minimum of 6 weeks before judging results. Track your pain on a 1 to 10 scale weekly so you have data, not impressions. Combine with the proven foundations: weight management, gentle movement, sleep, and adequate protein. Bring this protocol to your doctor or pharmacist, mention any blood thinners or NSAIDs you're taking, and confirm there are no contraindications for your specific medical situation. What castor oil packs will not do: they will not regenerate cartilage, they will not reverse osteoarthritis, they will not replace prescription medications for inflammatory arthritis. They are a pain management tool, not a disease-modifying treatment. Used appropriately, they fit alongside the rest of your care, not in place of it. Your grandmother was probably right that castor oil packs helped her aching joints. She didn't have research papers to prove it. Now we do. 6 studies, roughly 400 patients, a clear biochemical mechanism, and a protocol that costs $10 a month. The evidence isn't overwhelming, but it's real. And it's strong enough that this remedy deserves to graduate from folklore into evidence-based home care. In the next video on this channel, I'm reviewing tart cherry juice for sleep in seniors, a folk remedy that turned out to have surprisingly strong evidence. If you haven't subscribed yet, the link to the citation PDF for today's 6 studies is in the description, and the next video drops on Friday morning. Thank you for watching. Be well, move gently, and never start anything new without checking with your healthcare team.